So pleasingly, in the last week or so, we've seen an improvement in our overall vaccination rates for people, adults aged 18 or over, for their booster doses, and also for 5 to 11-year-old programs. So at the moment, across Golden Valley Health's local public health unit, there is 39% of people who are eligible for their booster dose, who are 18 or over, have had a dose. So that's an increase of 7% from last week. And for people in the 5 to 11-year-old age group, we're at 40% now, which is an increase of 11% from last week. So some good progress there, but still, sitting at 39 and 40% respectively for those eligible people to get their vaccines is still too low. And we are continuing to increase availability at our Vax hubs right across our system, not only in Shepparton but across the outreach sites in the Golden Valley for the state-based hubs. There's plenty of access to appointments. People can book online, and as of this morning, the appointments that we had scheduled for later today for both boosters and 5 to 11-year-old programs, those appointments hadn't been filled. So please jump online at coronavirus.vic.gov.au or 1800 675 398 to make an appointment. It's really important now that we get people through and vaccinated, because being vaccinated is the best way to, of course, reduce your chances of getting COVID and then ending up in hospital if you do contract COVID, or then being able to have a milder dose if you do attract it and stay at home. So the other thing we're really encouraging people to do is, there's a lot of COVID now still in our community, and we want people to come forward and get tested as soon as possible whenever they get those symptoms, no matter how mild they are. In terms of cases across our local public health unit, there's over 2,400 cases, the largest number being in Shepparton at 920, Mitchell Shire at 585 and Moira Shire 342. At GV Health at the moment, there's 15 people admitted with COVID-19, and none of those people are in critical care. From a staff furlough point of view, we have 75 staff that are furloughed at the moment, which is a slight increase from the previous few days. And our operations from the pandemic code brown point of view are holding steady and firm. We're still able to provide all of those critical essential services the community needs at this time, and our staff are continuing to work really hard in terms of being flexible and adaptable, working extra hours and in areas that they wouldn't normally work. So my thanks to them and all of the other agencies that are continuing to support the pandemic response across our region. So happy to take any questions.
What are you expecting in the coming week with school coming back and cases with that?
I think it's very likely that there'll be increased case numbers occurring throughout, particularly with Omicron. We know a couple of things, that it's really quite infectious and moving around the community pretty quickly, and often people do have only minor symptoms, but particularly children seem to have the most minor symptoms and sometimes no symptoms at all. So we're hearing examples of where, with the increased surveillance program that's now in place for children attending school, that they're actually, through that program, testing positive on rapid antigen tests when they didn't actually know that they didn't obviously have symptoms. So I think we're going to see some increased cases in the coming few weeks, and that's a good thing, because it gives us better line of sight of what's happening around the community. But it also means that those people who wouldn't have probably known they were positive can now isolate for that 7-day period and their household contacts, which will reduce the spread in the longer term.
Can I just ask about, I think there's quite a bit of a discrepancy between the Victorian Department of Health COVID active cases in Shepparton and then the ones that you said there was 900.
Sure.
And I saw that there was like 200 today. Can you speak to that?
Yeah, so that the new cases today is, well, I think what's happening there is in relation to there's a discrepancy caused by the probable and the confirmed cases. So what I'm talking to is the numbers that I'm speaking about are the probable and the confirmed cases, so the RAT cases and also the PCR tests. I understand the department quoting or using numbers that relate to PCR tests, but that's something you'd need to clarify with them in terms of what numbers that they're referring to. So from my point of view, I think the rapid antigen tests are a really useful and effective way to us understanding what the case numbers are. People who are testing positive are being required in fact to report that through the department's portal, so and they're being treated as positive cases and contacts accordingly. Good.
Are we going to ask?
Yeah. Do you want to ask me?
Can I just ask you a few questions about the ABC report and the AMA?
Yeah, sure.
Yeah, perfect. Can you tell me what measures the hospital has put in place to address alleged workplace issues?
So the issue, so we first became aware, the AMA published in their e-news bulletin the reference to workplace culture issues at GV Health. So obviously as a result of that, I've written to the AMA myself and requested a meeting for the opportunity to discuss those concerns more broadly. So I'm hopeful that in the next week or two we'll get the opportunity to sit down and talk about what those concerns actually relate to. At this stage we haven't received anything further than what's been published in the AMA's bulletin that they published last week. So I think that's a really important thing, is that at least we have the chance to sit down and understand what their concerns are and have a conversation about that. What I would say though, that overall in relation to GV Health's workplace culture, we go through a process every year in relation to what's called the People Matter survey. Every Victorian agency, public sector agency, participates in the People Matter survey. It's the key employee engagement and wellbeing measures that are used to gather information from our staff every year about about overall measures of culture and engagement. In the last year, our engagement scores improved by 3 percentage points from the year before, and that's in the overall engagement measure. So I think we're making some really good ground in improving our culture and wellbeing. And then if we look at how we compare GV Health, that is, to our comparator groups, which is other larger regional health services across Victoria, we're actually 2 percentage points better than our comparator group score. So from a culture and wellbeing point of view, we're doing a range of things to support our staff in leadership programs, both in terms of our emerging medical leaders and also all of our staff that undertake clinical supervision roles and positions of that nature to support junior staff. In relation to medical staff, they're all obviously part of that, but some of that clinical leadership and supervision programs relate particularly to medical staff. And then we're also having fortnightly meetings with our junior medical staff as well. We have an overall wellbeing program that's in place right across GV Health. So we're working really hard to improve the culture and wellbeing of all of our staff, and that absolutely includes our medical staff. So the first step for me at the moment will be just to have that initial meeting with the Australian Medical Association to understand what their concerns are a bit deeper, and then we'll be able to, I'm sure, move forward in a really positive way.
So you haven't had any forms of communication from the AMA before they released the statement the other day?
No.
And have you heard any reports of mistreatment or allegations yourself?
From our staff?
Yeah.
Across our organisation from time to time, we employ just under 3,000 people across GV Health. So in an organisation this size, and we're no different to any other health organisation that size, and indeed any employer, large or small, there will be from time to time instances where staff are not finding their work environment as good as they would otherwise like it to be. There's nothing in particular that is causing more general or widespread concerns. From time to time there'll be issues that arise in a certain workplace or a certain area. There's no pressure points at the moment more broadly across particular departments. there's nothing new or unusual that we've noticed in that regard, and we, as I said, like any other organisation, will deal with those things respectfully, in accordance with our values, and work through the issues with people in a respectful and calm way as and when those things occur.
Awesome.
Thanks.
Thank you.
Thank you.